Hair thinning is a prevalent concern for many women, significantly impacting self-esteem, appearance, and overall emotional well-being. It can occur gradually or suddenly, and while it is commonly associated with aging, younger women also face this issue due to various factors like hormonal changes, stress, and genetics. This guide will explore the causes of hair thinning in women, its emotional and psychological impacts, and comprehensive steps to help manage and care for thinning hair. Understanding hair thinning in women. Hair thinning refers to the reduction in the density, volume, and thickness of hair strands, which can be subtle or noticeable depending on its severity. Unlike hair loss, where patches of the scalp become bald, hair thinning involves an overall reduction in the hair's fullness. Women often notice hair thinning at the crown or temples, or as a widening part line. Hair thinning is typically caused by a disruption in the hair growth cycle. This cycle consists of 3 key phases. Anagen, the active phase where hair grows from the follicles, lasting between 2 to 7 years. Catagen, a short transitional stage lasting approximately 10 days, where the follicle shrinks detaching from the dermal papilla. Telogen, the resting phase lasts approximately 3 months, after which the hair sheds and the follicle prepares for the next cycle. When the hair growth cycle is interrupted, hair follicles may spend more time in the telogen phase and less time in the anagen phase, leading to thinning and increased shedding. Causes of hair thinning in women. Numerous factors contribute to hair thinning in women, ranging from genetics to lifestyle and environmental influences. Understanding the underlying causes can help women take appropriate steps to manage and prevent further thinning. Genetic factors, female pattern hair loss, androgenetic alopecia. Genetics play a significant role in hair thinning for many women. Female pattern hair loss, also known as androgenetic alopecia, is a hereditary condition in which women experience thinning of the hair at the crown and top of the scalp. Unlike male pattern baldness, women with androgenetic alopecia do not typically develop complete baldness, but rather diffuse thinning, which becomes more noticeable over time. This type of hair thinning is caused by the influence of androgens, male hormones present in both men and women. In women who are genetically predisposed, these androgens can cause hair follicles to shrink, producing finer, weaker hairs over time. Hormonal fluctuations are one of the most common causes of hair thinning in women. Hormonal imbalances due to pregnancy, childbirth, menopause, or conditions such as polycystic ovary syndrome or PCOS can disrupt the hair growth cycle. Women may notice increased hair shedding after giving birth, known as postpartum hair loss, or during menopause, as estrogen levels decrease, leading to hair thinning and changes in texture. PCOS, a condition that causes elevated androgen levels, is another leading cause of thinning hair. Women with PCOS often experience excess hair growth on the face and body, but thinning hair on the scalp due to the imbalance in hormones. A poor diet or lack of essential nutrients can significantly impact hair health. Nutritional deficiencies in vitamins, minerals, and proteins can weaken the hair shaft, making it more prone to breakage and thinning. Some key nutrients linked to hair health include iron. Iron deficiency is one of the leading causes of hair thinning in women. Iron helps red blood cells carry oxygen to the cells, including those that stimulate hair growth. Without adequate iron, hair follicles may not function properly. Vitamin D. Low levels of vitamin D have been associated with alopecia and other forms of hair thinning. Vitamin D is necessary for the creation of new hair follicles. Zinc and biotin. Zinc plays a crucial role in hair tissue growth and repair, while biotin, also known as vitamin B7, promotes healthy hair growth. Protein. Hair is made primarily of keratin, a protein. A diet lacking in sufficient protein can weaken hair structure and slow down growth. Stress is a significant factor that can lead to hair thinning. Physical and emotional stressors such as illness, surgery, or trauma can trigger a condition known as telogen effluvium, in which large amounts of hair prematurely enter the resting phase and shed within a few months. While telogen effluvium is usually temporary, it can cause noticeable hair thinning and exacerbate pre-existing hair loss conditions. Chronic stress can also contribute to hormonal imbalances, compounding the effects of hair thinning over time. Women experiencing stress-related hair loss often notice diffuse thinning, with increased shedding occurring across the scalp. Age and menopause. As women age, the natural hair growth cycle slows down and hair follicles shrink, producing finer, thinner hair. During menopause, estrogen levels drop, and this hormonal change can accelerate hair thinning. Estrogen helps hair grow longer and thicker, so when its levels decrease, hair may grow more slowly and become thinner over time. Postmenopausal women may also experience an increase in androgen levels, leading to hair thinning similar to androgenetic alopecia. Medications and treatments. Certain medications can cause hair thinning as a side effect. Drugs used for treating high blood pressure, depression, cancer, and autoimmune diseases can interfere with the hair growth cycle. Chemotherapy in particular can cause rapid hair loss due to its effects on rapidly dividing cells, including hair follicles. Birth control pills and hormone replacement therapy, or HRT, can also impact hair growth, especially in women who are sensitive to hormonal fluctuations. Environmental and lifestyle factors. Environmental pollutants, exposure to harsh weather conditions, and the use of chemicals in hair products can weaken hair and contribute to thinning. Frequent use of heat styling tools, excessive brushing, and tight hairstyles can cause damage to the hair shaft, leading to traction, alopecia, and overall thinning. Additionally, habits such as smoking, excessive alcohol consumption, and poor sleep can negatively affect hair health. Recognizing the signs of hair thinning in women is, well, really important. Hair thinning can be subtle at first, but early detection is crucial for effective management. So some common signs to watch for include wider part lines. A noticeable widening of the part line is often an early sign of hair thinning. Increased hair shedding. Finding more hair than usual in your brush, shower drain, or on your pillow can be a sign that your hair is thinning. Thinner ponytail. Women with longer hair may notice that their ponytail feels smaller or less voluminous than before. Visible scalp. As hair thins, the scalp may become more visible, particularly at the crown or temples. Finer hair strands. Hair may feel finer, weaker, or more prone to breakage. If you notice any of these signs, it's essential to consult with a dermatologist or trichologist for a proper diagnosis and treatment plan. Managing and caring for thinning hair in women. While hair thinning can be distressing, there are several steps women can take to manage and care for their hair. A combination of lifestyle changes, proper hair care, and medical treatments can help slow down thinning and, in some cases, promote regrowth. 1. Adopt a nutrient-rich diet. A healthy, balanced diet plays a crucial role in maintaining strong and healthy hair. Focus on including the following nutrients to support hair health. Protein. Hair is made up of protein, so it's essential to consume enough protein-rich foods like lean meats, fish, eggs, beans, and legumes to promote hair growth and strength. Iron deficiency is a leading cause of hair thinning in women. Include iron-rich foods such as spinach, lentils, lean red meat, and fortified cereals. Zinc and biotin. Zinc supports hair tissue growth, while biotin promotes hair health. Foods such as nuts, seeds, eggs, and whole grains are excellent sources of these nutrients. Omega-3 fatty acids. Omega-3s help nourish hair follicles, promoting growth and strength. Fatty fish like salmon, mackerel, and flax seeds are rich in omega-3s. Vitamin D. Ensure you get enough vitamin D by consuming fortified foods, fatty fish, and spending time in sunlight. If your diet is lacking in essential nutrients, consider speaking with a healthcare provider about supplements. 2. Develop a gentle hair care routine. Thinning hair requires extra care to prevent further damage. Adopt a hair care routine that focuses on protecting and nourishing your hair. Avoid overwashing. Washing your hair too frequently can strip it of your natural oils, causing dryness and breakage. Opt for washing your hair 2 to 3 times a week using a sulfate-free shampoo designed for thinning hair. Use a wide-tooth comb. When detangling wet hair, use a wide-tooth comb rather than a brush to minimize breakage. Minimize heat styling. Limit the use of heat styling tools like blow dryers, curling irons, and straighteners, as high temperatures can weaken the hair shaft and contribute to thinning. When necessary, use heat protectant products. Be cautious with hairstyles. Avoid tight hairstyles such as ponytails, braids, or buns that can cause traction alopecia and further damage to thinning hair. Opt for loose, gentle styles that don't pull on the hair. Air dry your hair. Whenever possible, allow your hair to air dry naturally rather than using a blow dryer. 3. Manage stress. Since stress is a known trigger for hair thinning, it's important to find effective ways to manage it.